The postpartum period is kind of a setup for depression because, you know, babies are not 9-to-5 jobs. They're around the clock, and frequently exhaustion sets in relatively quickly. And when you add to that the dramatic hormonal shifts of having a baby and the physical changes happening with your body and the, you know, new demands lifestyle-wise, it really can push people who have never, even people who have never had prior history of depression, can sometimes move into a zone that's actually a postpartum depression. Almost everybody has good days and bad days during the postpartum period that we call baby blues, but really quite a few women, especially when you ask them afterwards, in retrospect, admit that there was at least a little bit of time that things were more like an official depression for them. In the field of OB/GYN, you know, we break the pregnancy up into 3 trimesters. There's actually been a push to include the postpartum period as the 4th trimester because mental health things are so important during that time frame. And sometimes you can have problems with preeclampsia. There are some pregnancy-related problems that can occur following delivery also. And so there's really been a push nationally to recognize that the postpartum care is just as important as prenatal care in terms of improving general health outcomes with women. But I think the most important thing is to know that everybody has times when they're overwhelmed, and to feel comfortable talking about that to multiple people, both in your personal life and also your healthcare providers, in order to kind of bounce off of them how you're feeling and how they are perceiving how well you're functioning. Because sometimes when you're in the middle of it, it can be hard to know whether this is just something minor or whether it's something that you really need to be seeking help for.